we just make a start. We'll make a start with the announcement anyway, and just start by just saying thanks everybody for coming along, and thanks to our presenters as well for giving your time and doing your presentations and organising everything to get here and to do this. Really very much appreciated. As you can see, there's a running order on the I can do myself back then, I think. There's a running order on the screen there. And to start with, we're just going to ask Liz to make some announcements. Liz is our chair here at Mindfulness Wales. So I'm going to just hand over to Liz for a few minutes just to start us off.
Well, very briefly, how amazing is it that in Wales we're able to put on an event with all of this good practice? I'm just so proud that we're able to do this as one of our homegrown events. So I'm really looking forward to this, and thank you to all of you who are participating. And I think probably because this is a focused one, we've got some new people here who perhaps haven't been to our events before. So encouraging you to sign up to be informed about future events. We'll put our website address in the chat a bit later on, and there's a space there for you to sign up for our mailing list to make sure you get kept informed. And also we put our new events in there, and this is a homegrown one, and I'm really proud about that. But we've interspersed them now and again. We've been so lucky that world players in mindfulness have been willing to give us their time to inspire us in Wales. And our next event is Ruby Wax. If you go to the website, you will be able to sign up for Ruby Wax on December the 14th. And I think this is just such a compliment to what we're already doing in Wales, that people are willing to give us their time. And also on our website, you will see links to the recordings from some of our previous events. So you would be able to listen to Dan Siegel and Professor Catherine Weir, and some of the other of the more homegrown ones as well. Just a lovely mixture of things that we do in Wales and things to lift our spirits, lift our sights, and inspire us from outside. So you're all so welcome, and hopefully you'll join us again, and please go to our website and sign up to be kept in touch. But from here on in, back to Rob and the team there, and looking forward to hearing about things that we're already doing. And I'm very proud of Wales, so thank you for that.
Thanks, Liz. Yeah, so just a little bit of housekeeping, really, I guess. We'll start the presentations in a moment. If I could just ask people if they're not presenting, just to mute their microphones, and that'd be great. Also, we're looking to collate any questions or any observations or any comments that you might like to make. So we're going to do that in the chat. So if you go into your chat, and if you've got any questions you'd like to ask any of the presenters, after the presentations have completed, we're going to have a kind of panel, and people can. Sophia's going to collate your questions. We could also use our kind of hands up as well feature, or whatever the feature is on Zoom. I'm so used to using Teams now rather than Zoom. So, but I guess there's a way of kind of putting your hand up on Zoom as well. And if you'd like to do that, you can. So we're hoping to take us through now to about 8 o'clock-ish, and then if you're not too weary and you're happy to sit for another 20 minutes or half an hour. And ask some questions and participate in that part of today, that would be great. So I'm going to hand you over now to Emma and to John, Emma Evans and John Ryan from Vale University Health Board.
Hi everyone, I'm Emma Evans and I work for the Integrated Psychological Therapy Service in Vale. I'm a social worker, that's my professional background, but I'm also an integrated psychological therapy service practitioner at the moment. That's my current role. My colleague John's a registered mental health nurse, and we've been looking at implementing and developing mindfulness-based interventions in Vale recently. So we're going to have a little chat with you today about what we've been up to, really, a bit of overview and insight. So these are the type of things that this presentation is going to cover, looking at what we're doing now, some evaluation that we've recently had done with what we've been doing. Some of the things we're thinking about looking at in the future, and our kind of vision, and a little bit about interconnectedness then at the end. So I'll pass you over to John now, my colleague.
Hi, so currently in the Trust, we are running a number of mindfulness-based interventions. Initially, our colleague in about 2010 self-funded herself to do the MBCT training, and she ran a course for a while. And there was a gap until 2019 when we were funded to actually run it. So we have run pre-COVID, we have run 2 face-to-face groups, and we have run, since COVID, 2 online groups. We're currently running an MBCT group at the moment. There's plenty of people for the next group coming up. So we seem to have enough of a cohort to keep it going on a steady basis. We're also starting to do a pilot MBCT for life for staff to help support in terms of resilience and also on the mindfulness journey. So we're going to be doing one for staff in LUMS, the primary mental health care team, and ourselves in January. We're also going to be doing a pilot in April through primary care. And we're going to compare that to some other interventions in primary care. We also, I'm a DBT practitioner. A lot of funding has gone into DBT at the moment, and as we know, mindfulness plays a big part in that. So I'm guessing our role will expand in line with providing a good DBT service. Also, Activate Your Life is ongoing within the Trust, which is an online program. Could you change the slide, please, Rod? Thank you. So in terms of how effective is the version of MBCT being run in Hywel Dda, we have a psychologist currently evaluating the program, which will be ongoing in ongoing basis. One of the first questions she asked herself was, and she's written a paper on this, comparing face-to-face and remote delivery of MBCT. So what she found out really that the online version actually performed quite well, given the fact that there was a couple of caveats. There was the small numbers and different versions of core. But what she has found out so far really that the PHQ score 9 decreased significantly in the online cohort. Core 10 again changed significantly in the positive sense. She also found in the face-to-face and in the online course that the depressive symptoms reduce more than in published studies, which is really interesting going forward. Obviously, it's going to be an ongoing basis, and there's more information. You know, these might change, but it's incredibly positive. And nutrition rates were very low as well. We're quite a rural community, so traveling to face-to-face venues was quite difficult for people. So the online delivery proved to be quite effective. And I'll pass you back to Emma.
So we're also very keen on getting qualitative feedback because we're obviously mindful that we're very new and developing service. So the voice of the client has been really important, really, and the people who attended the courses. So during the course, we asked participants out of 10 what rating would they give, and we were astounded really. This is in relation to the online group that we recently just did, and the rating was 8 out of 9 out of 10. So we're really pleased really that clients felt that it was obviously helpful and beneficial for them, or even enjoyable or of benefit. So the positive themes that came from the participant feedback were the following: increase of self-care, understand the link between thoughts, feelings, actions, reduce the need for future treatment, relapse, improving close relationships, benefits of mindfulness. And something that really came out was kind of normalizing experiences. So John and I would share, obviously very brief sort of things with clients, that really common humanity. That was something that really came out. The negative themes were lack of opportunity to connect with other group members. So this was something that came up, but we were mindful that, in a group situation, clients may have had the opportunity after group to kind of meet. So what we did is actually at the end of the course, we invited the clients to to stay on without me or John there. So there's an opportunity to meet without us, to see whether they wanted to continue sort of contact. But we're going to obviously have to think about the ways that people can feel a bit more connected, perhaps through more breakout room delivery, because it was very new to me and John. We didn't manage to do much sort of breakout room activity. So we're mindful moving forward, that's something that we might want to look at. There was technical difficulties both sides at times. Cameras, microphones not working, but I guess that was an invitation for us to be compassionate to ourselves as people delivering it. And more recently, we've kind of tried to weave it in as part of the practice, so not allowing what comes up to be there, that type of thing. So we're finding ways of kind of managing that and getting around these sort of things. But yeah, so the pandemic really brought the opportunity for online delivery, because it wasn't something that was being obviously done with MBCT. So it's brought a bit of opportunity there for the online delivery. Okay. So these are the future considerations. So really mindful of the Mindfulness Wales Health Manifesto, and the matrix come with these are the types of things that I've highlighted that mindfulness could be used for. In relation to the above, there's actually interest in the local primary mental health care support service. Staff would actually like to run a group, so that potentially may be able to go somewhere. It hasn't gone any further than ideas, but with antenatal anxiety and depression and health anxiety, we've had people and long-term health conditions, been people in the current groups with experience those types of things, but no specific groups are present. But I think key with these things, it'd be nice to see if we could cultivate interest from staff, maybe working in perinatal service or in services with long-term health conditions. If people got an interest, maybe they could kind of specialise in running a particular group for that. I think there's also a staff member who's got an interest in psychosis and mindfulness, so we never know where these interests may go. Next slide. Vision. So yeah, personally, well, John and I find that the Mindfulness Wales Health Manifesto is it's powerful, really. It allows us to kind of focus on where we want to go, focus our energies and things like that. And I have to say that Rob Cannon-Davis, who's hosting this health event, has been absolutely so supportive. He's just an email away, really helping us to move things forward, really, with delivery of mindfulness, giving us ideas. He's just, as I said, an email away. So we're keen on, obviously, we are mindful that we're still in our infancy in a way. So really keen on ensuring that the courses that we offer are quality and they're accessible. They're all online at the moment, but we are obviously going to have to look at in person in the future. How do we make the courses more accessible for people in work, parents, things like that, people who may really benefit from them, or carers? We're really keen to ensure that client voice is, informing the delivery of the service, the voice of the client. And this is something that we recently set up within the Integrated Psychological Therapy Service, is a kind of a channel. I think we've mirrored sort of Rob's approach of networking. Rob set up a sort of big network of mindfulness teachers across Microsoft Teams, and we set up our own in IPTS. That's perhaps something that we could do throughout the health board, maybe link in with the council. I know Commercial Council, when I previously went to the education event, they've had some great things going on. I don't know what's happened at the moment, so maybe that could be an avenue we could link up with mindfulness teachers in our Vale, and that's innovation. I was going to leave this bit out, but I actually thought, what? Maybe there's something that we could do with the Wellbeing of Future Generations Act. I know this might kind of be our invitation to be more innovative, really, with mindfulness delivery. So we'll look at that in the next slide. So in Hywel Dda, the Green Health Network was set up in 2018. Only recently I've actually found out about it. And one of the consultant clinical psychologists, Suzanne Tarrant, has actually been highly involved in sort of well-being and mindfulness. And so I'm going to find out more about that and see whether we as a service could link in. What we're mindful is that after an 8-week course, we do offer a follow-up currently, but after that, how can we support people who attend the courses to maintain their practice in the long term? And I think if we could maybe get together with the third sector, get a list of signposts and organisations. I've heard that there's Qualitative, some really exciting organisations offer nature-based mindfulness activities. So we can work with the community and people to help people kind of sustain their practice over the long term. So that's something I think that we might be able to link in with, and perhaps even hold some mindfulness sessions outside maybe one day, as a follow-up in the forest or botanical gardens. It's just ideas at the moment, but I'm sure there's things that we could look at doing, and to help the Health Board meet its objectives with the Wellbeing of Future Generations Wales Act as well. Next slide. So these are Hywel Dda's statement of purpose, strategic objectives and priorities to support the annual plan. So as you can see, mental health is on there, and decarbonisation. So with the online delivery, again, as John said, you know, we're doing lots of work online, so it's reducing the need for transport costs, improving accessibility, so people can access support, you know, in their own homes. We're going to look at working with other organisations as well, third sector. Hopefully, that's our next next one. Bob. Interconnectedness. So I just want to.
I'm just wondering if someone's got their microphone on. So you're getting a bit of feedback there, aren't you, Emma? So if you could just check if your microphone's muted, please. And yeah, sorry, Emma.
That's all right. So interconnectedness. So I know this sort of sits quite nicely with mindfulness, interconnectedness, you know, nature and how things are connected. And I just reflected the other day, as sort of mental health practitioners, as NHS staff, you know, we never know how far, you know, what sort of ripples really our teaching will make, what impact it might have on people. I know I started my mindfulness journey back in 2012. It was Sarah Miliband was my teacher, and gosh, I'm here today now talking. I think I barely talked in that group. So you know, we never know where our teaching may go, and how people may use it in their lives. And John's going to finish off actually with a little poem, just to kind of sum up sort of interconnectedness in nature. So I'll leave this with you.
Okay, thank you. It's a poem by Mary Oliver, who I'm sure you're all familiar with. When I am among the trees. When I'm among the trees, especially the willows and the honey locust, especially the beech, the oaks and the pines, they give off such hints of gladness, I would almost say that they save me, and daily. I am too distant from the hope of myself, in which I have goodness and discernment, and never hurry through the world, but walk slowly and bow often. Around me the trees stir in their leaves and call out, stay a while. The light flows from the branches. And they call again, it's simple, they say. And you too have come into the world to do this, to go easy, to be filled with light and to shine.
Thanks, John. And
thank you. And sorry, I think we overran by a few minutes.
That's okay. I'm sure that's
apologies.
Thank you so much, both, and thanks for your presentation. And just to say, if anybody has arrived since we just started, we are recording the session, so you can catch up if you missed anything from the beginning. And yeah, there's a request if you would very kindly just silence your microphone unless you're presenting, just in case we get that that feedback thing that goes on. So I'm just going to hand over now to our next presenter, Dr. Umakant Dave, who is from, I think, Swansea University, perhaps you're representing, or I think the study you did was from Swansea. But I'll let you introduce yourself. Perhaps it would be better than me doing it. So I'll just move the slide on.
Thank you, Rob. And thank you, Liz, as well, Vishwapani. Mindfulness Wales is doing amazing work. Well, you might ask, I'm a gastroenterology consultant in Morriston Hospital, and you might wonder, what am I doing in this mindfulness meeting? I have deep interest in mindfulness and did a teacher training retreat in Bangor University, level 1 and level 2, following my MBSR course nearly 10, 11 years ago. And I've been teaching medical student mindfulness, just an introduction to mindfulness for last 5 years, and have been running well-being and mindfulness study days in Swansea for last few years for all healthcare workers. Have run some courses for not only doctors, but for NHS managers and number of other healthcare support workers, etc. So this particular talk, I'm going to focus about ESRT, which is Enhanced Stress Resilience Training, developed by Carter Labares, who's a GI surgeon from US. So next slide, please. What's quite well known is that within a year of joining medical school, the mental health of medical students significantly deteriorates compared to other university students. And then that deterioration continues throughout the doctor's life, professional life. And it is really important not only from their well-being point of view, but a doctor with mental health issue is 6 times more likely to make medication error and surgical errors. So it's in real interest of patient to have good mental health of their doctors. So we are keen to train all medical students in mindfulness. The key problem is that they have a very busy schedule, and having an 8-week MBSR course really doesn't fit in with the curriculum. Next slide, please. So Rebecca Crane introduced me to Carter, and then I've been able to introduce ESRT to UK, which has now only been not only in the medical student, but for a surgical trainee also is being done by Bethan and Sarah. And it's going to be introduced even more widely. So this is a mindfulness-based intervention, but compared to MBSR, which is inquiry-based, this is very much skills-based training, much more focus, maintaining the essence of mindfulness, but sort of much more focus on training the skills of mindfulness. Next slide, please. So we applied and got a funding from BMA, and we are running this randomized controlled trial in medical student. And this is the first in the world where we are checking the effect of ESRT in medical student. Next slide, please. So in ESRT has a 1-hour session, 5 sessions every week with optional 3-hour mini retreat. And we send pre and post class videos, which covers the theory and some previous participants' experience. So the whole hour is entirely experiential. So there is very little discussion during those classes. And these are the 5 headings of the classes that we run. Next, please. So in ESRT group, there will be meditation and coming to senses, some movement practice, which will be mindful yoga and qigong. We will also have some communication, mindful communication practice. Next, please. Active control group will spend the same amount of time with other faculty where they will discuss some lay articles. So we are controlling for just being part of the group is not the factor for improvement. So active control group will spend the same amount of time in the group as well. Next, please. And what measurements we are collecting before 5 weeks, so at the end of ESRT, and at 24 weeks, so 6 months later, we are looking for stress reactivity by perceived stress reactivity scales, psychological demand by Swedish demand control support scale. Next, please. Well-being and flourishing by mental health continuum, PHQ-9, Oldenburg inventory for burnout. And we are also looking for biological and physiological monitoring by heart rate variability, HRV. Next, please. HRV is app-based, so they can monitor their heart rate via app from the mobile and then upload those data. This is a measure of vagal tone and a marker of stress. Next, please. And the initial results from pilot, this is at the end of 5 weeks, but now we have a 6 months follow-up from a pilot, which shows significant improvement, which is sustained over 6 months. Next, please. And students found it quite useful. 80% thought it was highly logical and should be part of the course. And many of them felt it was quite transformative. Next, please. So these are the people who are part of the group. Carter Lebres is the GI surgeon from US who initiated this scheme. And my thanks to medical students who are volunteering for this trial. And we aim to finish the trial towards the end of this year, and then we'll have a 6 months follow-up. So we hope to get a full data set towards middle of next year. Thank you.
Well, thank you very much. Yeah, thanks a lot. And yeah, this is all very new to me. I didn't know this was taking place. So it's really interesting to hear what you're doing, and the fact that you're hoping to get that kind of embedded into perhaps into training as well, which is great. Yeah, so thanks very much for that. Next up, we've got Dr. Helen Watkins from Swansea Bay University Health Board, I believe. It's the Welsh Centre for Burns and Plastic Surgery. So Helen, I'll move on the slide, and you can direct me as to when you want me to move it on again.
That's great, thanks very much, Rob. Hi everyone, as Rob said, my name is Helen Watkins, and I'm a clinical psychologist based in the Burns Centre in Morriston Hospital. So the Burns Centre is a regional service, so we cover the South Wales, but also the southwest of England, so Bristol down to Devon, Cornwall and Gloucester Salisbury. So all patients with significant burn injuries will come into us, and it's a lifespan service, so it's for adults and children. And we receive about 1,000 referrals a year. So we've got a adult intensive burns unit. We've got adult and paediatric rehabilitation wards, and we also run outpatient clinics. And there's 2 psychologists there, myself and my colleague Nicola, and we work across the service, so across the care pathway. Both in the intensive care units, the rehab wards, and in the outpatient clinics. And we'll work with a range of presentations with patients from sort of trauma, body image issues, adjustments, and engagement in rehabilitation. So in terms of my own sort of personal background and why I'm talking here tonight, I guess, is that I've got a long-standing interest in meditation, long-standing practice. When I was putting this presentation together, I realised with a little bit of a shock that it actually goes back 30 years, because I learned transcendental meditation just before I went to university. So that was 30 years ago, and I've had a sort of yoga practice for a similar length of time, I guess. And I've increasingly sort of incorporated mindfulness into my clinical work, probably over the last about 7+ years, and really over the time that I've been working in the Burns Centre in particular. So I've done a lot of training in acceptance and commitment therapy and use that a lot in my clinical practice, which I know other presenters mentioned earlier. There's a lot of mindfulness in acceptance and commitment therapy. But I also attended MBCT group as a participant in 2019. Found it extremely beneficial for my own practice. I started practicing mindfulness much more, and really started to think about the how useful this could be for the staff in our centre, which is a fantastic centre to work in, but often a very high stress one. And also with the patient groups that we see. So I've been really fortunate that I've obtained charitable bids funding from Swansea Bay Health Board to train as a mindfulness teacher with Bangor University and the Mindfulness Network, and I obtained that funding with the support of my psychology manager and the clinical director for the Burns service in 2019. So I'm currently on the teacher training pathway. Can I have the next slide, please, Rob? So I began my level 1 training in 2020. It's all been online, which wasn't quite anticipated, but has actually been extremely sort of effective. I wanted to start with mindfulness-based stress reduction. I'm hoping to train in both mindfulness-based stress reduction and mindfulness-based cognitive therapy. A lot of the reading I had done was in mindfulness-based stress reduction, and actually I think also I attended the mitigation retreat. I'm guessing a lot of people on the call tonight with John Kabat-Zinn, the online mitigation retreat, 13 weeks last year, and just found that really inspiring, and it really helped with my own kind of stress management over that time at the beginning of the pandemic. So I really wanted to immerse myself in mindfulness-based stress reduction. So in terms of my teaching, again, I've been extremely fortunate that I have a long-term friend and colleague, Dr Jo Solden, who works in Maggie's in Cardiff, who's also a clinical psychologist, but also a very experienced mindfulness teacher. And she very kindly agreed to co-run my first MBSR group with me, and we had 10 participants. 5 were from Cardiff and Vale that Jo had already started a course with just prior to the pandemic starting, so she wanted to restart a course with those staff, and 5 staff members from the Burns Centre as well. So we did that January to March this year, and that was over Zoom. I then ran my second online group myself for 6 members of staff, September to November. So I've just finished that a couple of weeks ago. And this has all been under regular supervision. I'm very fortunate. I think Sarah's name has already been mentioned this evening, Sarah Milbands tonight, the supervisor, which is just hugely beneficial. So as I'm running the courses, I'm having generally sort of weekly supervision, which I'm finding really, really helpful. My MBCT training is planned for April 2022, and then I'm really, as similar to other people really, that I'm in the early stages at the moment of implementing this, but my plan and hopes are that I can offer sort of rolling 8-week courses to staff groups. I've already got a group of staff who are interested to attend next year, but also to patient groups as well. So that's the plan. And I was just going to run through some of the feedback of the courses we've had so far. So the next slide, please, Rob. So we just did some qualitative feedback. So I've had out of the 16 participants that have come along so far, we've had 11 forms back. I know there are a few others on the way, but this is all the information I've been able to collate so far. So in terms of benefiting from attending the course, the average score was 9. between sort of 0 and 10. Has the course impacted on you professionally? 10 out of 11 people said yes. Personally, 10 out of 11 people said yes to that. Have you noticed any positive changes in your reactivity in work? 7 out of 11 people felt they had at the end of the course. And have you noticed any positive changes in your ability to manage stressful situations? 9 out of 11 people had. So to have the next slide, please. So just some quotes here from staff saying that the course and the ongoing practices had huge impact, and they're specifying there how it's impacted them in terms of their sleep, less anxiety, less irritability, making staff more aware of their responses to certain situations. I know this third quote actually is from a junior member of staff, quite new onto the unit. I knew her as a student as well, and obviously she's working in a high pressure environment at the moment, and one of her quotes was that she's more present and alert, and allowing her to manage her time better during shifts. And then the physical aspects of anxiety. So in this other participant's case, the constant butterflies greatly reduced, the most part gone. So I should have actually said it. I don't think I've mentioned the staff groups range from, we've had a couple of ward managers, or junior staff, nursing staff, physiotherapists, managers, clinical librarians, so who are sort of mixture of the MDT. So we could have the next slide, please. Changes noticed in themselves and observations by others, much more accepting of the way things are. This second quote actually sort of means quite a lot to me, really, because they're talking about having a much more positive internal narrative. And again, that was really good to see. And actually, that was discussed quite a lot in my last group about feeling that they were valuing self-care a lot more, and actually being compassionate to themselves. And again, I think the current NHS that we work in, that's just so important for staff. Family noticing they're much calmer, having less headaches. And then another nursing colleague there mentioning that her own colleagues has noticed a positive change when she's dealing with stressful situations, and using techniques such as STOP. And the next slide, please. Sort of most challenging aspects of the course, so we asked them what they struggled with as well. So to make it as accessible as possible to people, we ran the courses in the evenings, so it was 6:30 till 9 p.m. But that is really quite a commitment. But I must say, everyone who started the course finished the course, and everyone in both groups attended the retreat day as well, which I was really impressed with, actually, in terms of the amount of time they put in. Trying to do the two and a half hour session in the home environment, though, is actually challenging, and understandably so. One participant mentioned about finding the Zoom sessions quite difficult sometimes and feeling a little bit disconnected. But actually, I would say the majority, similar to, I think, to what Emma said earlier, actually said that they found Zoom very kind of okay to navigate, really, and there still was a sense of a group sense of sort of connectedness within the group, although I think most people said that they would like to have some time to sit in person as well when restrictions allow. So also finding the time to do an hour's practice with all of the other pressures that they've got in their lives. And then the first attempts at doing longer mindfulness meditation practices could be quite challenging, and the first attempt at silent meditation was a real eye-opener, said one of the participants. And the next slide. So recommendations and maintenance. So I think, perhaps the most important thing, 100% of would recommend the course to colleagues. I'm hoping, really, again, I think other presenters earlier has talked about the sort of how things can sort of roll out, and already some people on the second course were colleagues of people who had obviously been in a small unit, but they had spoken. There's still quite a big nursing group, and they knew people who'd been on the first group, and that's what had made them interested. And I've already got staff approaching me because they've been talking to other members of staff that are going through the course. So yeah, 100% of staff would recommend the course to colleagues. 10 out of the 11 that filled in the forms intended on continuing with the regular mindfulness practice, and I actually know the numbers higher because some of the people who intending to come to our monthly online group. Actually, I haven't filled this in. So just to mention that Joe and I decided that it would be quite important if we could to help people continue with their practice. So we've committed at present to running a monthly online group. So we do that for an hour a group, and we've had an hour a month. So sometimes Joe and I are there together. Sometimes we'll take it in turns. And we've had really good attendance at that, and people have been really keen. And I know, again, from my own practice, I found it quite important to have things to link into to keep up my own practice. So we're planning on continuing with that. And the second group of staff have joined that first group of staff. And then I just really liked this quote. I think it was from one of the physiotherapists saying that she only wished she had discovered meditation years ago. And there's another quick kind of quote or story that I was just going to quickly mention, was that one of the ward managers stopped me in the corridor last week to say that she was doing a dressing change with one of our patients. I think it was the week before last, and he sort of paused her at one point and said, "Can I just ask you something?" And she said, "Yeah." And she said, "Can I ask you a personal question?" And he said, I don't suppose you practice mindfulness, do you?" And she said she was really sort of taken aback and said, "Yeah, I do actually." And he said, I thought so," and didn't say much more apparently. But I was just really, I was touched to hear that. She was really touched, and I guess it's led me to think a little bit about how staff's own mindfulness practice is going to be impacting upon patient care, and that would certainly be something that I'd like to sort of investigate over time. Okay, so I think that's it for the Burn Centre bit. I have actually got another slide at the end of my presentation in terms of my counselling psychology colleagues. They've asked me if I could just mention the work that they're doing. And they've been facilitating mindfulness for health groups, I think, for a number of years. So as I'm sure most people on this call know, it's an 8-week programme for patients with psychological issues around their long-term physical health conditions. So this is Alison and Liz, and they mentioned that pre-COVID, they would run an average of 2 groups a year. I don't think they've managed to run any during the pandemic, but they're looking to set this up as an online group over the next few months. So I also just wanted to mention that on their behalf. I'm not sure whether I've run to time, Rob, but I'm hoping I'm not too far over.
Oh, you're doing lovely. That's brilliant. Thank you, Helen. That's
okay.
Really interesting work as well, isn't it? And kind of again working with staff, but then also looking to work with patients as well, and that effect that it's having. I think so.
Yeah,
for staff as well. So yeah, thanks very much.
Okay.
So I've gone on to the next slide actually. So I'll just introduce Richard Bundy, who's from Vale Steps as the chief exec there, and he's going to talk a little bit about making mindfulness and stress management programs accessible to general populations in Cwm Taf, Morgannwg, and he's doing a little bit in Gwent and in Bevan as well now. So, Richard.
Yeah, I'll mention that. Thank you, everybody. You have to excuse me. We've got fireworks going off to my left, which is a bit distracting, but I'll try and crack on. But yeah, if you want for the next slide up, Rob. We were established in a particular set of circumstances within Cwm Taf, which has later become Cwm Taf Morgannwg. Following a successful pilot within primary care mental health support services, Vale Steps was set up as a special purpose vehicle to address issues in Cwm Taf, which were that Cwm Taf had the highest rates of mental health problems in Wales, had the highest rates of prescribing of antidepressants, and also growth in prescribing of antidepressants in England and Wales, and clearly within the area there are high levels of deprivation, and people will be well aware of the links between deprivation and mental ill health. And if you want to skip through the next 2 slides, Rob, I mean, clearly primary care professionals, GPs, would complain that they didn't have access to other services, so they were often prescribing antidepressants, not because it was the best course of action, but it was the only course of action because services weren't available. So we were ultimately seeking to address mental health at the general population level to make a service that was accessible based on mindfulness and stress control, both 2 6-week programs, and the Mindfulness for Every Day was developed by a psychologist, Sue Nam, who sat within Cumtaf Health Board, and felt that there was a greater need for access to services and develop that program. So we were looking at developing a service that was accessible, served the whole of the Cumtaf footprint. The ambition was for it to become a genuine alternative to antidepressants, not a replacement for, because they can be life-saving in many circumstances, but giving both practitioners, but also more importantly, people choice, and ultimately transforming the response to stress and anxiety. Sometimes it feels that if you're experiencing stress or anxiety, there are 1 or 2 options. You go for counselling or you get medication. So changing the way people view how they can address their mental well-being, and aligning to sort of nice guidance around stepped care, where you're not in the first instance automatically prescribed antidepressants. You might experience social prescribing, signposted to other services, and we were a key part of that. And the delivery involved a comprehensive program at scale, probably not seen anywhere else in Wales. And again, focused on stress control and mindfulness, both of which had been seen to be effective in piloting with primary care mental health support. And within that, obviously targeting the general population in areas of deprivation, socially isolated communities, doing some targeted promotional work, really getting into communities, engaging with local community groups, developing relationships as a means to breaking barriers. Next slide, please, Rob. So ultimately, what we were talking about achieving was behaviour change, and people may be familiar with the work of the Behaviour Insights team. But if you're looking to change and get people to adapt their behaviour to improve their well-being, it's always seen as being best achieved if you make access to services easy, attractive, timely, and social. And by what we're doing, we deliver at scale in places close to people's own homes, or hopefully making it easy by effective use of social media and engagement with community groups, so hopefully making the offer attractive so that people are recommending it. We're bringing people together, so they're seeing other people who are also seeking to change and improve their well-being alongside, in some senses pre-COVID, up to 70 people sat through a Mindfulness for Everyday program. And also not having to be on a long waiting list, so delivered at point of need. So we've delivered a program that you never have to wait long for one of our courses to start. So Rob, I'll highlight a bit of what we've done in the next slide. So in 2019-20, we'd expanded into Bridgend because of the change in the health board footprint. So at that point, we were commissioned and funded by Cumtaf Morgannwg to deliver 100 6-week programs, not all mindfulness, 50% mindfulness, 50% stress control. And just shy of 3,000 people attended during that year. And we delivered in 30 different locations across the Cumtaf footprint. And then the next slide, we seek to evaluate the project utilising WEMWEBs, which is the Warwick Edinburgh Mental Wellbeing Scale. So participants were asked to complete a questionnaire at the beginning and then at the end. And you can see that a significant number of people, the blue is low well-being, the red is medium well-being, and the green is high well-being. You can see a significant number of attendees through their own scaling were presenting with low well-being, and by the end of the program, there've been a significant number of people who were in low well-being, a significant increase in those that rated themselves as having medium to moderate well-being, and a not insignificant increase in people who found that they were experiencing high well-being. Now, the University of South Wales, the Welsh Institute for Health and Social Care, undertook an independent evaluation and followed up 6 months after completion of the programs, and people were reporting the same levels of well-being 6 months after completion than they were as they were at the end of the course. So it was delivering enduring well-being, and the next slide will show similar outcomes for people going through the stress control program. The next slide gives a bit of an overview of 2021, and we all know what happened in March of last year. So we entered our second year of delivery, but COVID struck and we weren't able to deliver a program face-to-face. So we quickly established an online program. And over the course of the last financial year, so the end of March, in excess of 5,000 individual attendances were recorded. So we saw significant demand, particularly in January to March of this year, where we saw almost as many people accessing the service as we had in the previous 9 months. We'd seen the development of new services to students in both HE and higher education and further education through partnership with Coleg y Cymoedd, Merthyr College and University of South Wales. And I think Emma mentioned outdoor mindfulness. We piloted a service over the course of the last 12 months in partnership with Qualitative. So that's introducing our work to the woodland wellbeing workshops that Qualitative delivered. And we successfully engaged with what are regarded as more isolated communities, so the outlying communities of Cwmtaf, so Mardy and the Merthyr Vale, excuse me, the fireworks going off again. So we've seen exponential growth, not only in terms of the numbers of people accessing the service, but new services being delivered. And Rob mentioned earlier, at the beginning of this year, we piloted a program called The Present, which is a less formal program of mindfulness that helps people, similar to our Mindfulness Everyday program, integrate mindfulness into their everyday without necessarily having to go into the formal practice. That was a project that was co-delivered with colleagues in Iron Bevan Primary Care and Mental Health Support Services, and I'm really pleased to say we've secured funds to continue that work through into next year. So we've seen the Valley Steps footprint move from just Cwmtaf into Gwent, although we were already working with Gwent College as well as part of the work we're doing in colleges. Next slide, Rob. And then since we've been established sort of late 2015 into 2016, we've seen in excess of 16,000 residents of Cwmtaf attend one of our courses. You know, I think the WEMWeb's data shows that we're achieving significant improvements to people's well-being. And in addition to the WEMWeb's data, as part of the evaluation by WISC, they engaged in questionnaires and interviews with professionals in primary care, including primary care and mental health support services. And the last 3 points, you know, came out of that evaluation that showed that, you know, there was a significant trust in what we were doing and confidence in the value of the offer, and that there was a growing view amongst professionals that the mindfulness program, the stress control program, were an alternative to antidepressants. And then there was some comparative analysis done of other areas with similar demographics in terms of prescribing rates of antidepressants, and showing that the interventions were having a positive impact upon prescribing regimes. And now Valley Steps forms part of the depression treatment pathway in the health board area, where doctors are advised to signpost to us in the first instance for patients with mild to moderate depression. So, you know, we've increasingly shown our worth and playing a key role in supporting and relieving pressure on primary care mental health support services. Next slide, Rob. And just really, I say that I don't think anything's been delivered in Wales at this scale. And I think there's a question mark over whether if you invest in those services, whether there would be the demand. But I think we've shown the demand is there. It's just services historically haven't been that accessible. And you know, it's been difficult for many people perhaps in isolated communities to access services because they're all centralized. But by reaching out almost in a model of assertive outreach, you can see that you know, areas that are often described as hard to engage certainly open themselves out to new experiences as a means to improving their well-being. I think that's it, Rob. Yep.
Thank you. Thank you. It's not often we get people that can arrange a kind of firework display whilst they're doing the presentation, especially some of the highlights. You know, it's quite impressive, Richard.
Yeah, it was all timed. It was all timed. We wait for the crescendo now.
Pardon me. Yes, thanks very much, Richard. And yeah, don't forget, just a reminder, if you've got any questions, to add them into the chat. And Sophia is managing and kind of picking out questions from the chat, which we'll come to in just a little while. But I'm just going to move on to Gail now. Gail Evans from the Cardiff and Vale University Health Board. Gail, you there?
Yes, I'm here. Yeah, thank you, Rob. And having seen all the slides now, I wish I'd put some real effort into these, and so I apologise about the very kind of plainness of them. But yeah, so I'm just going to talk briefly about Cardiff and Vale, and specifically around mental health services and the kind of provision that we've developed around mindfulness. So I guess just thinking back where we started was in 2013, where as part of the mental health measure, primary mental health support services was being developed, and one of the psychologists who was developing that service was really keen that there was some kind of mindfulness as part of that being delivered to people within primary care. So she got a group of us together of different professions, but I think the key thing was that we all had a practice. You know, we practiced mindfulness in our lives and had a real interest in it, and together to think about how it was that we could provide something. I think what she'd had in mind was something kind of like a one session sort of, you know, and something would be transformative. But we argued our case and managed to get them to agree to us offering a 6-week course. And that what we wanted to include within that was mindfulness-based stress reduction, mindfulness-based cognitive therapy, but also some compassion-focused elements to it as well. So we compiled that, and Bangor University and Rebecca Crane in particular was really kind and helpful, and just sort of checking that we stuck to a structure that felt that would be appropriate. So we called that a Mindfulness for Wellbeing course then, and that was piloted in October of 2013. So from that, it was a 2-hour weekly session and carried over the 6 weeks. I think that what became clear was that actually we did need to also have a workshop prior to people attending, because often people were being referred into this course, and actually I'm not sure the clinicians always knew what mindfulness meant or was, and was kind of, so people came along a little bit confused about what we were doing and what this was, because they were expecting sort of to clear their mind and be relaxed, and actually we were asking other things of them. So we developed, so we reached out to 7 weeks then and added a 1 week, an initial workshop, and then explained what the course would be, and check then to see if that was something that people wished to kind of pursue, I suppose. And so the course is very much, as you would expect, both theoretical elements to it, but also experiential. So it was about actually experiencing mindfulness. The meditations were really key in that, and home practice, and all those key elements you would expect. So can I have the next slide, please? So I guess we, at this time, up until recently, everything has been face-to-face, and we try to use community venues. And like I said, through lockdown, we've also run Zoom groups, but where lockdown was eased, we also tried to run face-to-face groups, because we also appreciated for some of our population, they would be unable to attend via Zoom for a variety of reasons. So we wanted to make sure that the options were open. We run the groups both mornings, evenings, and afternoons to try and, because we also knew that people were working, so to try and capture as many people as possible and be as flexible as possible. The people who attend are referred to us both through primary care, but also secondary care mental health services. So there will be a degree of severity with their presentation, and specifically would be around anxiety and or depression. But often we have people who refer to us where actually people really don't know what else to try, and they come along, and actually the beauty of that has been that we've had such lovely experiences from people who felt almost that people had given up on them, and then have come through our course and noticed such changes in them. So I think that we didn't really adhere to the criteria. We were a bit more flexible in about who could come really. We aim to try and run it 4 times a year. But we're a very small pool of staff who deliver it now. So we're down to there's 3 of us across the service. And for myself, I've also either got other clinical demands. So it's not kind of in my work plan as such, it's kind of added on. So that can often create some difficulties about how we're able to kind of continue running these groups. So just to say, I guess over the last 8 years, we've had 450 people who've attended the workshop, and then 300 people who have then gone on to complete the course. And we do pre and post measures. So the core and the Warwick and Edinburgh Wellbeing scale, and we sort of see sort of improvement in well-being. So on average, then going from moderate with 58 to an improvement, the post-course up to mild at 36. And also with the Warwick and Edinburgh Wellbeing scale, just seen a difference there as well. So yeah, so we also ask for feedback as well on the course as well. So we're always kind of, and each session we ask for feedback about how the week's gone, so people can also, to make sure that they're able to bring up anything as we go through as well. The other thing I've also been part of is developing in 2015 a mindfulness course for the staff. And that was really as a response initially because of the referrals we were getting to our patient group, that there seemed to be a lack of understanding of kind of what mindfulness was. We wanted people to experience it for themselves. I also felt that we might better support the people that they were referring into our course, so they could help, when challenges came up, and they could support them in that way. But I think what we noticed that obviously, it was interesting actually. So we mirrored the staff group on the one that we were offering for patients. We wanted staff to experience it, although I think they thought they were coming in to learn how to teach it, but that wasn't the case. It was really to, like I said, experience. So we also asked them to do outcome measures as well, which was an interesting thing, just for them to experience what it felt like. It's actually quite vulnerable to be recording how you're feeling. And I think there's a little resistance to that. There was also certainly with home practice and things that I found staff were interested. They didn't respond always well to that, but as time went through, as the weeks went through, so a real shift in staff and kind of their sense of well-being, and noticing some of the things they were doing which were becoming unhelpful to themselves. And yeah, so it was a real learning curve, I think, for staff, actually noticing the critical voice and how they didn't take their breaks and all those sorts of things. And so I would talk about actually the difference that it made when they started becoming aware of these things. Yes. Okay, should we go on to the next one? So in 2019, we changed it to the 8-week course, and specifically because we were outcome measures were showing that it was improving in well-being, and also the levels of stress and stuff were really quite high. So I thought we'd actually focus it into a mindfulness-based stress reduction course specifically for staff, and again including some compassion-focused content, self-compassion work as well. And then I've been fortunate, as one of my colleagues has as well, to be supported to do the mindfulness, the Masters in Mindfulness in Bangor University. So I used that as an opportunity to do my dissertation then on the staff course. and just considering the hypothesis was mental health staff that complete an 8-week mindfulness stress reduction course will self-report an increase in levels of compassion and well-being. So the study showed, so we had 20 participants who stayed the full 8-week course, and they reported then significant increases in well-being. So using the Warwick and Edinburgh Wellbeing scale. It was interesting actually, the levels, the average level on the wellbeing scale was really significantly low, and almost surprising that they were in work, but they were in work with very kind of low levels of well-being, but saw a significant increase after the course, and also in self-compassion as well. So I guess, so yes, the well-being levels increased, the self-compassion levels increased, but they already had high levels of compassion anyway. So there was kind of hit the ceiling sort of with that anyway. And over 170 staff members have completed the courses so far. And what's been really good is the managers have supported them to do it in work time. So we do it as part of their work. And initially we had issues with people being called out of the course, but that stopped as well. So we got agreement that when they came to this course, they could stay the full thing and not kind of have to be taken out of it. And we've got a really long waiting list, really, to attend the next one, which will be in January, which I'm really pleased about. So yeah, that's what we've been doing so far.
Thanks, Gail. Thanks very much. That's yeah, gives us a good view of kind of your provision for both patients and staff. So that's great. And I'm just aware of the time as well, so I'm going to make my little bit quite swift if I can, and just do a quick summary. I'll put the slides up so you can read them. You might be wondering why there are mushrooms on there. I might try and explain that a little bit. I guess Wales, from what you've heard today, Wales is quite a rich and fertile ground, I guess, for mindfulness. We've got the psychological, the kind of the Matrix Cymru, the Psychological Therapies Management Committee kind of document that gives some guidance around, therapy provision. And within that, we've got MBCT, and as already mentioned, dialectical behavioral therapy with quite an underpinning of mindfulness, and acceptance and commitment therapy also with that underpinning of mindfulness. A few people have mentioned compassion. There's a compassion-focused therapy group and resilience group, which we currently run in Aneurin Bevan. We've also got a leading people program, which is teaching mindfulness to leaders within Aneurin Bevan as well. And that's been developed kind of in-house. We've had some great support from Ben Waits and Catherine Walters, who are two of our lead psychologists within Aneurin Bevan. And we've trained, well, they've trained on the course over the last 6 years, and 100 plus kind of leaders within the organisation. And also there's been a promotion of taking care, giving care around within Aneurin Bevan as well, which is a kind of very compassionate based opportunity for staff to come together and share some of the difficulties, I guess, that they've experienced within their work environments. So there's some of the things, I guess, that create that fertile ground that our little mushroom myceliums are kind of growing in. As part of the program within Aneurin Bevan, we've developed coverage across Gwent. We've got our own resources, which we've shared with other health boards as well when asked. We've supported our practitioners with peer review meetings and clinical supervision. We've gathered data. I guess in terms of mindfulness, as I say, it's delivered in variety of formats across Aneurin Bevan as part of the matrix and kind of following that kind of Matrix Cymru therapy provision. We've also got an employee in the Wellbeing service that's trained in delivering MBCT and is trained to has delivered to employees within the health board. We've managed to get mindfulness, the 8-week course, onto the in-house cognitive behavioral therapy course. So as of next year, it was going to happen 2 years ago, but then something else happened. So as of next year, our colleagues who go on to the CBT course in-house will be trained in mindfulness as well. And they come not just from therapy services, they come from a much broader and wider health board cohort. So we've delivered quite a few courses, over in excess of 75 courses, in excess of 500 patients, and that's just in primary care. There's also courses running in our secondary care, community mental health teams as well. Somebody mentioned we've created a special interest group. There's a Teams channel, so if you are in health or in the health board, if you want to let me know and you want to join the Teams channel as a special interest group for mindfulness, drop me an email and I'll make sure that you're added to that. Richard mentioned we've co-produced with Valley Steps the present at a community level. So instead of having to be referred into a service by a GP, with the present, it's more open access and delivered at a community level. So that's something that's been piloted, and we've secured some funding to run for the next 12 months. We're also running wellbeing sessions within the health board. I run half-hour daily mindfulness for wellbeing, and we've linked in with Welsh Government and some community organisations on that as well. So we are offering those to people, employees across Wales, from Welsh Government, from the third sector, from local authorities, from health boards. They can attend the sessions I run, and people from Aneurin Bevan can attend a Welsh Government session or a third sector community session. So those are some of the things that we've been doing. I just want to talk a little bit about the future, and I think Liz mentioned earlier what those spores are that are released and where they land and how they get kind of fertilized. But we're looking at things like strengthening the Welsh network and community of mindfulness practice around health and health boards and well-being as well. We'd like to make sure that there are discussions happening, I guess, in health boards around mindfulness-based programs and their implementation, and perhaps bringing them to the notice of the local psychological therapy committees or even to the national. Developing a kind of vision or an implementation strategy for that contribution of mindfulness-based programs for people living with perhaps long-term physical health conditions. And I think there's probably some opportunities there, and particularly with things like the present as well, which links into the last one, widening access to those programs for the general public, but also the public sector staff, workplace well-being. And I think quite a few people this evening have talked about what they're doing locally about getting those things set up. And so I guess the question for me then, I guess, hopefully maybe there's some answers in the chat, which I can't see, but how can we take part in this mushrooming of mindfulness within Wales and in health and well-being? I'll stop sharing my presentation now. Perhaps I can see more people. So thanks for sitting through that, and I'm aware that we ran on a little bit, and yeah, that's one of the things that I've been quite a diverse kind of information sharing that we wanted to kind of give. I know Sophia's been collating some questions or comments. So perhaps Sophia, if you could put your microphone on, perhaps you could help us out with the next bit.
Sure. So most of the questions that were put in the chat have already been answered by the people who the questions were addressed to. Should I read those? There are two that haven't been addressed yet. Oh, Rob, I can't hear you now. You're muted. Sorry, I still can't hear you.
Can you hear me, Sophia?
There we are.
Yes, I can hear you, Richard.
It helps if I turn my microphone on, Sophia. So yeah. I just wondered if you could, maybe you could ask the two questions that have not been answered yet, and then perhaps just some of the other questions just in the time we have, or if there's any hands that go up.
Yeah, absolutely. So they're kind of similar. So someone asked, for someone with a background practice and some yoga teacher training, any tips for first steps in terms of training and integrating aspects of mindfulness into clinical practice?
Okay. any volunteers for an answer? I'm quite happy to maybe answer, but so basically, for someone who's, I'm not sure if they're working as a clinician. I presume they are. Then, Sophia, is that the case? Do you know?
I'm not sure. Maybe Kath wants to elaborate. Yeah, I presume they do have a clinical background. Yes, she says she's a clinician.
Yeah, and I guess I mean I think a few people have mentioned how they engaged with delivering mindfulness in clinical settings, and I think certainly within an Iron Bevan, but I guess other people have said something similar. I think Bangor's been mentioned a few times this evening as a kind of a place to begin or to engage with that training, I guess, to deliver courses and classes. And certainly that was my way of, I guess, of doing that. It was to, I was from a cognitive behavioral therapy background, and then went to Bangor onto the master's program for mindful approaches to teaching or something like that, I think it was. But basically, yeah, that's kind of how I did it. And then I guess through that, then I started to deliver classes initially to peers, I think, which Helen mentioned earlier, to people I worked with within an Iron Bevan. They were my initial cohort, and then to as I became more experienced, I guess, with the teaching program, with to actual patients. Then, and that's how we started to develop a program within our primary care mental health support service. I don't know if anybody else wants to talk to that question.
So just to say that already answered the other question as well, which was how to train to be a mindfulness teacher.
I think, did I see Chris's hand go up? I don't know if there's any other hands, but I think I did see Chris have his hand up.
Hi, Rob. Yeah, thanks, and thanks to all the speakers. I'm really impressed. I hope we can get a set of the slides out. I've got about 6 pages of notes that I've made here, but it was difficult to keep up. There were so many nuggets in each presentation. But thanks to all the speakers. Rob, you asked the question before, how do we get those spores around Wales? And I would say not just around Wales, around the UK and the world, because there's some excellent first-class practice here. And ably supported and underpinned by the decades of work of in Bangor, led by Rebecca. So you said, how could we do that? I think the presentations that we've had are really first class and need to be get in front of some other audiences. And I would say assembly members, depression is the biggest health burden on the whole of the planet. I think Wales suffers more with its mental ill health than other parts of the United Kingdom. It's a big issue for politicians, MPs and Assembly members. We've got friends in the Assembly, Darren Miller from the Conservatives. We've got a link into Plaid Cymru and Jane Bryant from Labour. If they could convene a meeting in the Assembly or even a virtual meeting to get political support for what's going on here in South Wales. And I'm also a deputy chair at a deputy for Denbighshire Voluntary Services Council, and I attended the All Wales CVCs run by WCVA a month ago, and Wellbeing is something they're focusing on. I think if we were to give a presentation to WCVA and its constituent members across every county, or virtually every county in Wales, it would fit well into their wellbeing agenda. And then finally, how do we get what's going on in South Wales to all of the other health boards? I think if you've got political support to start off with, third sector support to as well, then taking it to those health boards in North Wales and well across the whole of Wales, that they could see this excellent homegrown practice that we've got here in Wales. It might put some political pressure, some third sector pressure, and some health pressure on them to do likewise.
Thanks, Chris. That's yeah, something helpful to think about, I think, and kind of digest. And I think it'd be nice to have some way of kind of harnessing, I guess, some of the thoughts of everyone that's come here today as well. So I know you've provided some questions that have been answered in the chat. I did notice that there was another question there for Gail as well, wasn't there? Just come in. Is that right, Sophia?
Yeah, a new question for Gail. How did you get the managers to release their staff and retain them for the training phase? Shortage of staff is so common, and staff are becoming rarely released for training.
That's a really good question, and I think it was difficult at first, but we started small. So the staff, because I work in older people services, mental health services for older people, so because of the manager system there, they did it because we were noticing that staff were really struggling. Actually, they agreed that they would allow people to have the time. So I was mindful of when I organised the course. So we looked at first thing in the morning, so they would come in slightly earlier and so be able to manage that. And I think once we'd agreed to do that within our service, there was kind of this precedent. So adult services then felt obliged to also allow their staff, because they also had high levels of sickness. So it was we kind of manipulated it slightly in that way. So there was kind of that sense that, well, whilst that service is doing it, so why isn't this service? And then we built on that. But it has been difficult, but there's also pressure because of our high levels of sickness, and because of because we could evidence that it was making a difference, and staff were feeling the difference and were talking to their managers about that. It became part of also their PADR, so their appraisals as well. They got agreement that way. So it was, yeah, we managed it that way.
Thanks, Gail. I don't know if anybody else would like, because I know there's a couple of other people that maybe have had similar experiences. I don't know if anyone else from the presenters would like to talk to that particular question as well. Helen?
Yeah, I'm just happy again. That was a sort of pressure for us, especially with sort of intensive care nurses and rehab nurses getting any time for them. It is really tough, but that's why we did it in the evening. And our kind of compromise was that because a number of staff were saying, look, well, I'll just do it in my own time, but really felt that you know, to value staff, it was important to get the staff and the time back. So that was the kind of compromise, that it couldn't necessarily come out of their shifts, because that was really difficult, but they were able to build the time, and then they took the time back. And then I think, as has been mentioned as well, it's because there's a lot of discussions in the NHS at the moment around staff stress as well, and when I think it's now, even if managers are sometimes a little bit reluctant when they look at the amount of time, no manager is very easily going to say, I'm not happy to invest this amount of time in our staff members. So once they've started letting staff come along and seeing the changes and staff are asking for it, I'm finding staff the managers are generally supportive now, but we've just found a way of them having the time back really as well. So we are managing to do it even in very acute care settings and things as well. So even though mine's very small scale at the minute, but there is the support there, so which is great.
Thanks, Helen. Umakant, you've got your hand up as well.
One of the way to address this is run a course for managers, and I did a session for senior manager, including chief ex in what used to be ABMU, because many of them, they don't really understand what mindfulness and their benefit is. So once they are convinced, or they see the benefit for their personal well-being, then they are much more likely to support this. And also just having a short introductory sessions for much bigger group, and then means not everyone needs full MBSR course, and we may not have facility, but at least we introduce them to the basic concept and some simple practice to begin with, and then some of them can do the full MBSR.
Thank you. Yeah, I think that's my experience, was, I said, running it for colleagues, and I think one of the benefits of that was that when I was able to offer it then to patients, and colleagues knew a little bit about what it was, and it actually had some experiential kind of practice of attending. And we did it as a well-being thing as well. and it was an hour, and it was time that was given to everyone for their own well-being. That was a few years back now. However, that was the kind of start, I guess, within Erin Bevan, really, was that way. Were there any other questions? Rebecca?
Just one question from Tommy.
Oh, sorry.
Would be interesting to
I
see
see.
if ESRT mushrooms into other staff areas.
Yeah, well, in US, they are now trying ESRT for many other groups, for Marines, for people working in zoo, not only the healthcare worker. And the advantage of ESRT is much shorter course. And also some of the groups they felt don't like sort of inquiry-based approach. They don't like to talk about their vulnerability, etc. And it helps those groups. But the key thing is that ESRT doesn't move away from the principles of the mindfulness practice. So all the deep practices and spiritual basis is kept in ESRT, even though it's much shorter. And I see that it has a role complementing to MBSR, because 45 minutes of home practice for busy nursing staff or a medic may not suit everyone.
Thanks. I noticed, Rebecca, you had your hand up, but you took it back down, so I don't know if you wanted to ask a question. Well, I can't hear you though. Sorry, Rebecca, we can't hear you. No, nothing, sorry. Might have to type it into the chat, possibly. I just noticed, Zoe, is that a question you've asked, or is it just, you've just mentioned that Cwmtaf Morgannwg are also doing mindfulness-based courses for staff and patients, which are very popular. Lots of work, so there's lots of work happening across, across Wales. Sorry, Rebecca, you're still not coming through. Anybody ask her a question? I can't see on the second page, so I don't know if there's anybody over there, but okay. I'm also aware the time, so it's 27 minutes past 8, so I think we were looking to finish on time. I'm sorry, Rebecca, you're probably not going to get to ask your question, but yeah, I'm going to apologise for that. You're just not coming through there. So yeah, I think I just want to round off before we finish, and I'd like to thank everybody that came along to present to start with, and for your time that you've given to doing that, and also for the information that you shared as well, and also that request that went out, I guess, at the end of how we can continue to develop these things. Chris has come up with some great ideas, about engagement with politicians in Wales and the opportunity that might lie there. But if anybody has got any other ideas or suggestions, then please do get in touch with us and share them. And again, I'd just like to mention the network for health staff. If you are a member of a health board, you want to join the special interest group Teams channel, then again, just let me know. You'll find me on the global diary, and yeah, and that was it. I don't know if there's any last words you want to say, Liz, before we finish.
Just to say what I put in the chat, really, what an impressive array of practice. I think we can be very proud in Wales, and though we all might want to do a lot more, the fact that this will mushroom, those spores will spread across. What you need are the mushrooms to start with, don't you? Just to spread those seeds. And I think we've got that in copious quantities in its various forms. across the health service. And when we look at some of the work that's crossing over into communities with Richard's work and the work that's going on in education, I think we set out our aim as being helping Wales to become a more compassionate, kinder, fairer and more sustainable society. And I think what we've heard tonight really helps us to take that forward there. This is mind-blowing change we're talking about here. And thank you all so much for all the work you do. And please stay in touch with us in Mindfulness Wales, because there's something about critical mass, isn't there? We can do this together. Just knowing what each other are doing, just that awareness that we've all got now about what's going on. So please stay in touch with us and let's take this forward together. Thank you all so much.
Thanks, Liz, and thanks everybody. Have a good evening.